The Health Secretary, Wes Streeting, has urged frustrated NHS staff working in what he calls a broken system to stay and to help to change it.
And this comes as the government today begins a consultation on a 10-year plan for the health service in England. Let's speak now to Stephen Kinnock, who's the government's Minister for Care, joins us from Westminster. Good morning. Thank you for joining us.
Good morning.
So, a big public consultation exercise, listening to ideas, but that's going to take months, isn't it? And then you've got to collate all those ideas and decide which of them you might implement. Realistically, it's years off anything that's going to be suggested coming into real life, isn't it?
Well, of course, our work doesn't stop because we're doing this big national consultation and conversation today. We're working at pace on things like sorting out the junior doctors' strike. We've put 1,000 new GPs onto the front line. We're passing legislation for a fair pay agreement for adult social care workers. So there's a number of immediate actions on our manifesto commitments, our first steps. That, of course, is work that's ongoing. But for too long, the NHS and care system has been in crisis management mode, just looking at the short-term work. We are looking now to create a transformational reform programme. This big national conversation we're launching today, I would urge your viewers to get involved. The online platform, nhs.change.uk. There's going to be over 100 events happening across the country. It's a huge opportunity to work with the government to deliver on our three big shifts, from analogue to digital, from hospital to community, and from sickness to prevention. Those are the big long-term shifts. That is going to take a decade of national renewal. Of course, there's immediate actions that we're working on right now and will continue to work on, but we've also got to think about the long term and fixing the foundations of our health and care system so that it's fit for the future and back on its feet.
OK, and I'm sure there'll be lots of people this morning who'd like to get involved and would contribute to that debate, but you promised change at a general election just a few months ago. You've had 14 years in opposition to come up with plans and ideas. I think people might wonder, haven't you got a plan ready to go to hit the ground running rather than just a consultation period and talking about it?
Well, as I just said, we have actually done more, I would say, in the last 14 weeks for our health and care system than the Conservatives did in the last 14 years. But we are also a different government with a different culture, and that culture is about recognising that you can't just deliver change from behind a desk in Westminster or Whitehall. This change that we want to push through is got to come from our communities, from our staff, from everybody with lived experience and everybody who cares about our NHS that we cherish. But if you cherish something, you've got to be prepared to change it. For that change to be lasting and real, it means we want everybody to be getting involved and to shaping it and working with the government. The plan will be published in the spring. There's going to be another big fiscal event next spring and comprehensive spending review next spring. So it's a great opportunity for us, coming off the back of that fiscal event, to deliver the reform that we need, because of course we need investment in the NHS and care system, but there's no point pumping more and more money into a system that isn't working. That's a bit like turning on the taps when the plumbing's not working. So the big national conversation we're having is going to be a major first step towards fixing the plumbing, getting the system working, using technology, moving from hospital to community, and also getting people to live healthier and better lifestyles, which of course helps to take pressure off the acute sector.
In the general election campaign, Labour promised an extra 40,000 GP appointments every week. When will people watching this morning get those appointments?
Well, we have said that we're going to deliver to that target, 2 million in a year. I'll be happy to come back on your programme in July on the one-year anniversary of our election victory on the 4th of July to update you on progress. But what I can tell you is in the coming days, crack teams of clinicians from hospitals which have really been very effective in terms of bearing down on their backlogs are going to be going out into other hospitals to help and support and advise on how to get a system and a process in place that really drives up productivity and efficiency. And that's at the heart of our big national conversation today as well. It's how do we get the best of the NHS to the rest of the NHS? There's pockets of great practice, good examples of how we're working. The question is how to replicate that, scale it up, roll it out across the country, and that's the huge opportunity that we have before us. But we recognise that we have a mountain to climb. After 14 years of Tory neglect and incompetence, our health and care system is on its knees, as Lord Darcy correctly diagnosed. Our job is to get it back on its feet and fit for the future.
One of the things you're proposing is a neighbourhood health service, so sort of local hubs where people can go for treatment that at the moment they might have to go to a hospital for. So it takes the pressure off the hospitals, I guess. But Labour did try to do this. Gordon Brown tried, Tony Blair tried, and it didn't really happen. Persuade us that it can happen this time.
I recognise that there's scepticism out there. The Tories spent 14 years beating the hope out of the country, and people are sceptical. But I also believe that there is a genuine sense that there is real urgency. The depth of the crisis that we're in, I would argue, is the biggest crisis we've had in our health and care system since its foundation in 1948. So people cherish our NHS. They also know it has to change. And what we want to do with this big national conversation is create a national movement for change. We really are all in this together. Our health and care system belongs to everyone. So I believe that there's a sense of urgency. That crisis that we're facing will drive us to really build that lasting change. We're going to have a decade of national renewal, a 10-year plan that drives those big shifts from hospital to community, from analog to digital, and from sickness to prevention, and that's going to give us a health and care system that's fit for purpose in the 21st century. OK,
you keep saying you've got a plan, and we've been talking about the NHS, but what about social care? You're the care minister, and we've been waiting a long time from successive governments for a social care plan, and still nothing from this new government.
Well, we've hit the ground running with our fair pay agreement for adult social care workers. Arguably the biggest crisis the adult social care system is facing is 130,000 vacancies.
When will we get a social care plan?
Yeah, and that's, of course, part and parcel of a plan to create a national care service. We're going to develop national standards for the care service. We're going to fix the crisis in the adult social care labour market with all those vacancies through our fair pay agreement. We're going to create a much better interface between adult social care and the acute sector. 14% of the people currently in hospital are medically fit for discharge, but are not being discharged because they don't have a care package.
Sure, but you have said, the government has said, there will be a big published plan for social care. It affects millions of families across the country. When will we get it?
Well, that will run. Our adult social care plan will run alongside the healthcare plan that we are bringing forward today. We recognise that adult social care is complex, multifaceted issue, and it requires consensus building. So that is absolutely a commitment of the government, and we'll be bringing forward that plan in due course.
In due course. So will we get a plan
in our adult social care system
in the next 12 months? Will we get that plan?
Yes, absolutely.
OK. And within that 12 months, in the next 6 months?
It's coming very soon. It's a plan that is, we recognise that it's urgent and vital. I think what you have to recognise is that we've inherited a system that's on its knees and that requires a huge amount of fixing. They did have their charging reforms, but of course they made absolutely no financial commitment to that. We're facing a £22 billion black hole in the in-year public finances. So it was another work of fiction, really, in terms of the previous government's plans. This government's going to be honest with the country, honest about the state of our public finances, honest about the state of our public services, but really bold and ambitious about what needs to be done to change them. And the 10-year plan for the future of our health system, the plan for the future of our adult social care system, they will be working in lockstep with each other to deliver that change.
While you're with us, Minister, can we talk about the Minister, the honesty of Sir Chris Hoy, Olympian, sporting hero who confirmed over the weekend that he now has terminal cancer, started as prostate cancer. We've heard from Prostate UK here in the last few minutes on Breakfast They say that there should be targeted screening for men like Chris, who have a family history of prostate cancer, and for black men as well, who are particularly vulnerable. And they say it could happen with the stroke of a pen in Westminster. That targeted screening could happen. When will it happen?
Well, I'd like to pay tribute to Sir Chris Hoy. He is a sporting legend. He is somebody that is hugely admired and respected across the country. And I think the way in which he has expressed himself around what's happening to him is just such an example of courage and of the way in which people deal with these terrible issues. And my heart goes out to him and to his family and loved ones. He's right about prostate cancer. We absolutely need to drive up testing. The PSA test is something that we want to maximise right across the country, and we are absolutely taking Sir Chris Hoy's comments on board, and all of those who are committed to dealing with prostate cancer, and the government is going to work and focus on that. I can absolutely give you that assurance, and I'd be very happy to come back onto your programme as soon as we've got more to report on that.
OK, I mean, the National Screening Committee was told 2 years ago that these groups, people like Chris who have a family history of prostate cancer, black men, should get targeted screening. Will you give a public commitment this morning that that's something that will happen in time?
I can absolutely commit to the government looking at that and giving it very, very serious consideration. It's absolutely the right way to go in terms of our shifts from sickness to prevention and from hospital to community, and it just is the right thing to do. So, you know, we're absolutely committed to dealing with prostate cancer, improving detection rates and improving treatment. And I can absolutely give you the commitment that we are looking at that very seriously, investing in research and development and investing in terms of raising awareness and getting more men to go and get those tests.
Stephen Kinnock, thank you for joining us.
Thank you.